friend/coworker first called me in a nervous, frantic tone, explaining to me how she had just witnessed a little girl get hit by a car on her way home from work. She jumped out of the car and helped the girl to the best of her abilities with her CPR knowledge. Today I will be talking to you about CPR, which stands for cardiopulmonary resuscitation. Cardio referring to the heart, pulmonary to the lungs, and resuscitation just meaning to resuscitate. So a few things I will be covering are: when do we use CPR, how to perform CPR briefly, and what details are essential and why, including some safety precautions. Most of my information comes from the nationally recognized lifeguard certification, StarGuard, because that's what I'm certified through, so that's where all my knowledge comes from. So when to use CPR? There are three main reasons we use CPR. The first is someone has suffered a heart attack, which is basically a blockage preventing blood flow from getting to and from the heart. The second is cardiac arrest, which Ringgold explains in his article Cardiopulmonary Resuscitation as a sudden stopping of the pumping function of the heart. And the third is secondary cardiac arrest, which is basically the cardiac arrest is the result of something else. So for example, in drowning victims, their lungs fill with water, preventing them from being able to breathe, and them not being able to breathe may cause them to go into cardiac arrest. So lots of things can cause these three factors: heart attack, cardiac arrest, and second cardiac arrest, including drowning, like I mentioned, alcohol poisoning, old age, other health problems, and more. So what will you need to perform CPR properly? First, you'll need personal protective equipment, which in CPR is gloves and a rebreather mask. Personal protective equipment in general is just anything that protects yourself from harmful fluids or maybe getting burned if you're in a lab or something. You'll also need an automatic external defibrillator, also known as an AED. This is the machine that shocks the heart, and an emergency action plan, which most facilities have, which include calling 911. So the first part of PPE you need is a rebreather mask. It's in the red case right there. It's triangularly shaped. The longer part goes over the patient's mouth and the smaller part over their nose. And the little nub sticking out is what you breathe into them through so that you don't get any nasty stuff from patients. You don't know what they have. In the case of somebody else coming to the scene, if you're not alone, they'll bring this type of mask, which is bigger. It's a bag valve mask. You use it because it delivers more of a percentage of oxygen into the person you are helping. That's the only reason why you switch. The reason you need two people is because it's obviously bigger and bulkier. So performing CPR, before you actually perform it, you want to assess the scene. Is the scene safe? If it's not safe, you don't want to put yourself into danger. The second is you want your PPE, you want your gloves on, and you want to make sure you have your mask. The third is you want to tap on the person and shout, because most of the time, people lay around everywhere, and sometimes it looks like they're dead, but they're taking a nap. It does happen. So you want to tap on their shoulder and just be like, hey, are you okay? And then you want to activate your EAP so that EMTs get to the scene as soon as possible. And the last thing you want to do is you want to assess the patient. For adults, you check their carotid artery, which is on their neck for a pulse. For an infant, it's their brachial, which is on their arm. And then you want to put your ear to their mouth and look at their chest to see if it's rising and falling, and listening to see if they're breathing or not. So performing CPR, if you're by yourself for an infant and an adult, it's always 30 chest compressions to 2 breaths. If someone else comes, the only thing that switches is an infant is 15 compressions to 2 breaths. A child is usually treated as an adult. You differentiate between children and infants based on their size. Usually if they can stand up on your own, you treat them as an adult. Modified CPR is when your breaths do not go in. So when you're tilting their head back and giving them breaths, if you see that their chest is not rising and falling, This means that there's probably something obstructing their airway. A lot of the times it's just their tongue, so you want to re-tilt their head back and try the breaths again. If that does not work, then you will do modified CPR, which is you're doing your chest compressions, but before you give your breath, you want to open their mouth and see if you see anything in their airway. If you do, then you swipe it out with your pinky, as gross as that sounds. That's why you have your gloves on. And then you'll give them their breaths, and you continue this even after you've swiped something out, because there could be something else. So when do we stop CPR? When there are obvious signs of life. They start breathing again, or this is usually a miracle. The scene becomes unsafe, support arrives, an EMT arrives, you're too tired to continue, or an AED arrives. As soon as the AED arrives, you want to put it on because it'll tell you how many cycles of CPR to go through. It'll tell you when it's going to deliver a shock. Okay, so important things to note. All three of these things are absolutely vital. Your CPR is basically useless without one of the following. You need your AED, you need your compressions, and you need your breath. In the article Improving Survival from Sudden Cardiac Arrest, medical doctor Common stated that more people can survive sudden cardiac arrest when a particular sequence of events occurs as rapidly as possible. He's referring to the sequence of events. For almost 2 decades, chest compressions and positive pressure ventilations, especially in early CPR, which is just saying that time is of the essence. Early CPR always works better than late. Also, in the article Cardiopulmonary Resuscitation and Post-Cardiac Arrest Syndrome, published by Oxford Medicine in 2015, author Nolan states, outcome of cardiac arrest and CPR is dependent on these 3 things. And finally, if you ever find yourself in a position where you are going to perform CPR, you don't want to panic. Swore stated in his 2006 article, CPR Training and CPR Performance, published by the Academy of Emergency Medicine, that 37.5% of people stated that they did not perform CPR, not because they didn't have knowledge, not because they weren't certified, but because they panicked. So I hope after this presentation that you all get certified, because you never know when you are going to witness somebody in a life-threatening emergency and when your knowledge and skill set can help them.
All right.